Okay, third of the series. So on this one, we're going to talk about the C. So we talk about airway, we talk about breathing, which, by the way, not many people seem to have done their homework. You're bad students. But not many people ask me about a question about the homeworks and stuff. But anyway, it's not really a homework. It's more for helping you. But hopefully those two videos, from a few people that I talked to, seemed like it was helpful. And some of them didn't watch it all, but they liked it, how it was talking about it. Anyway, hopefully it was helpful. And this time we're going to talk about circulation. So on circulation, I'm going to talk about two subjects, but I'm just going to do a quick intro on trauma. And then we're going to do the other part on the shocks himself, but a different approach to shock that I don't see many people teach, and I don't know why, because this is pretty much the best way to teach it, I think, because every time I show it to people that way. And actually I had a good experience on that in the last ACLS class. There was a student, like I think a 4th-year student, nursing student, and I show him this way, and suddenly the whole ACLS came so much clearer to his mind that this concept he didn't understand, and suddenly just by showing it this way, he made it all clear. So, and that despite my accents. so let's start. So the first four things that I want to talk about is the 4 riders of apocalypse of trauma. And why I want to talk about it is because one of them will be shocks. And so I want to talk. So let's talk about it right away. So hypotension is one of them. Hypoglycemia is the other one. Hypoxia is the third one. And the fourth one, hypothermia. Every time that you have a person with a trauma, always check those 4. That's why, for example, in the protocols of EMS, it is to take a sugar on every trauma. It's because of that one. It's very easy to fix. It's a very easy fix, and in kids especially, you'll use. And why is it so important? It's because actually, this one will relate to hypothermia as well, because if, for example, we start shivering or something. So, for example, if you're in a car, think about it. You're in a car accident, you're not prolonging extrication. I stay in the car. It's minus 20 or minus 15 outside. I'm in the car while waiting for them to extract me. They take me out. I'm starting my body is in hypotension because I'm losing blood because let's say I fracture my femur. Because I fracture my femur, I'm losing more blood over there. I'm also I'm not really dressed for the environment because I was in my car, so I had the heat on and everything, and so I'm pretty much dressed as I am in my house. And now I'm in minus 15, so I'm getting cold. I don't have the heat of the car to show me, so I'm going to a hypothermia. Hypothermia, I'm going down. What do I use to keep me warm? Shivering. What does shivering use? Sugar. So sugar is used to go down, but as well as now, as I'm trying to keep my body warm, I'm also trying to fight this hypotension. So that means I'm creating epi, norepi to try to compress all my vessels and everything. Again, using some sugar to create this and to put all those factory to function. So I'm using my sugars. So that's why, for example, every trauma, even if it's a traumette that we think, because basically maybe the person was just, stuck in their car and there was a lot of intrusion and they don't need to be dying of it. It's just because of the elements and where they are, they could have used their sugar. So that's why they want sugar on everybody. Hypoxia is a big one because anything that they decrease their oxygen, then we'll talk about in shock, is very important because this is the definition of shock. A lot of people think it's low blood pressure, but it's not. It's a lack of oxygen to the tissue. And so hypotension, let's get into that one. So I just wanted to talk about those 4 because every time that you have someone, please think about those ones, especially hypoglycemia. We always forget about it, but it's so easy to do. Do a chemistry, it's so quick, and yet so important just because of this, just because of where they were. And sometimes we have a tendency to forget about it because we're in the hot environment, and we have a tendency to forget about the hypoglycemia. Okay, so hypotension. So there is 4 categories of shock, and they are hypovolemia, cardiogenic shock, distributive shock, and obstructive shock. Those are the 4 categories of shock. But no, there's many shock. There's anaphylactic, septic. Yes, but they fit in the other categories, and we'll see about it and stuff. So usually that's how people will teach you about shock. What I don't like about this way is that it doesn't really explain, okay, so I got an hypovolemic shock, so what's the treatment? Well, I don't know. But when you start seeing shock the way I'm going to show you, it not only explains why the shock happens and why we're calling this kind of shock and why they're in shock, but also is what is the treatment for those shock. And the formula is very easy to remember. So it's cardiac output equals stroke volume times heart rate. So if you remember this, basically you have about 80% of all we do in emergencies. Meaning that why we put someone on a monitor, why do we slow down people with fast AFib, heart rate? Why is Sears, one of the symptoms of Sears is high heart rate? Because of this, because I'm trying to create a cardiac output and everything, so that way my heart rate is increasing. Why do I give why do I give fluid to people with hypovolemic shock? Because of a stroke volume. So basically everything that we do has an importance because of that formula. And basically this is where the shocks separate themselves, not so much with the heart rate, but because of the stroke volume. So in pediatric, this formula applies as well. We'll talk about it just quickly because we do still see kids. But in adults, our heart rate is about 160 to 100. And kids, I mean, like depending on the age and everything, but kids can almost go, like some kids can be almost between 150, they can all go up to about 200 heart rate and still be not that bad. And this is wise because kids can be dependent on, they don't have much of a stroke volume, they don't have much of a reserve, their system is not as mature as we are, and it's not as, they cannot depend so much about the stroke volume, but they can depend on their heart rate like crazy. They can double their heart rate if they want. They can go from, like I was saying, so they can go up from 110 to 220, and they have a heart rate of 220, and yet they're like, and they're still alive. You try that to go at a heart rate of 200. Like at 150, 160, when we're on the treadmills, we're like, we're short of breath. So at 200, we're like, we're dying. But kids, they can go up to 200, and that's why. But also, that's why kids will go like this, and boom, will crash because of this. Because when they cannot compensate with their heart rate, they're done. They're finished. They cannot compensate anymore, and the stroke volume cannot do this. So then, if their heart rate cannot compensate to that 200 that was maintaining that cardiac output to certain numbers, now suddenly, let's say their heart rate goes from 200 back to the 110 that they're supposed to, their cardiac output goes down because the stroke volume is not compensated. So basically they increase that number and stuff. So because we cannot do that much, we don't pay so much attention on it, and we'll spend more time on this one. So stroke volume. 3 things that affects the stroke volume. Preload. Afterload. And the third one, the pump himself. So the contractility. And this